This is Janice from InterX, and she's going to talk to us today about how to treat pain without drugs and to heal the body from the inside out. So, Janice, take it away.
That was great, Jennifer. Well, that was really good. So welcome. And, you know, I put on here, I did a presentation for another group, and so I kind of took this off of there, and this is just my heart, and so I like to share that. So I like to welcome everyone. And first I'd like to say, and I really do, I consider my patients and the people that the Lord allows me to meet my friends. And so I look at it as, you know, I pray that, you know, all of you may prosper and be in good health. That's my wish for everyone. And my prayer for everyone is that, you know, deep down, because it's so hard when you have pain and when you, it's not just pain, it's the low energy. It's all those things that happen when your body just is not doing what it's supposed to do. And so my passion is that, again, that deep down that you can prosper as an individual. So I'm going to go into my first slide, which shows you the picture of InterX. So what is InterX? InterX really is a therapy, but it's an electrical device, and it provides interactive neurostimulation. It does generate a pulse that stimulates the skin, and it stimulates the skin at the area of pain and inflammation. You'll see in some slides following the way we use it a little bit differently, but just because we've learned that over time, that the pain, even though it may be in a joint or a certain area, the stimulation does have a real interactive nature that once you put it on the skin, you kind of become part of this whole circuit. So it's real interesting how the device works. It actually sticks to the area of what they call low impedance. And what low impedance means, it's where the energy is going in the body the best. It's where there's less resistance in the area. So you're looking for these areas around an injury, if it's an injury, or if it's a problem like something like Ehlers Danlos, you've got these little energy ports, like I'll call them little ports of, you know, where you can go into the body. And oftentimes those places are trigger points, they're tender areas. You know, if I had you guys pushing on certain parts of your arms, behind your ears, down your legs, on your sides, if you have like leg pain, you know, those different areas are going to be very tender. Those are the places that you would treat. So we teach people how to do this. And again, it's a communication. The device is communicating to the nervous system. So it's a constant communication back and forth. So the InterX device is a Class 2 medical device, and it does carry the European CE mark for pain relief. So we have this like all over the world. It's where the clinic is, our clinic's in Dallas, Texas. But we have the device overseas in Australia. We have it in Spain, in Singapore. I could go on and on, Russia, and so forth. But in the U.S., we are FDA cleared, and then we have the European CE mark in overseas. So it's a symptomatic relief of management of chronic and chronic intractable pain. So when you're looking at, you know, EDS and other more chronic conditions, you're looking at the chronic intractable pain. So usually that's, you know, anything from sharp pain to stabbing pain to burning pain to radiating pain. And then along with that goes a lot of other symptoms. We also see people who have had surgery, post-surgical, and then post-traumatic pain. It works really great on that. So again, oftentimes, like I was talking to you, Jennifer, earlier about how Ehlers Danlos can sometimes go into more chronic pain like RSD or chronic regional pain syndrome. We work really good on that, especially if you moved in from like an Ehlers Danlos place, you know, where you had a dislocation and you had a procedure done and it just didn't work, it didn't heal. Oftentimes it can move into something more. You would want to get on that side of pain or that problem really quick. We are certified in the U.S., like I said, and it is a very portable device. So this is the home unit. And so the picture that's up there right now is a professional device. This gives you numbers, and the treatment stimulation comes out of this head. There's no gels that are necessary. We do add a little bit of water just on the person's skin because usually there's some dehydration going on. Plus, you do need something to just kind of help the skin, help the body, and so water works really well. And then the home unit, which would be for home users, a personal unit, looks like this. It's a little smaller, but there's different attachments that we'll go over in a minute too. So I always ask, what does the InterX do? And so I just wanted to list a lot of things that we see on top of other chronic issues. So sports injuries, acute sports injuries, chronic muscle spasms. It's great on muscle spasms, and it's pretty incredible, like even on restless leg syndrome and things like that. So there's a whole trick on how to treat it. You don't treat the leg, you actually treat a place in the face to help restless leg syndrome or spasms in your leg. Any kind of sprain, strain, obviously anything in the shoulder like rotator cuff injuries or impingements. Impingements happen all the time when you're inflamed, where you'll just turn your neck and you'll get something caught. Your neck will feel like it's real tight. Tennis elbow, knee pain, all the things that are listed here, which are mainly strains and sprains and injuries. And then you have more inflammatory conditions or more inflammatory problems like any type of itis. So any kind of tendonitis, brachial plexitis, an IT band syndrome would be more inflammation. Postoperative surgeries to manage just any joint, any type of replacement. You can treat right over metal. So there's no problem treating over a joint replacement of the shoulder, of the hip, of the knee, right over it. There's nothing that's going to happen because the stimulation only goes skin deep. It's very, very shallow depth of penetration. This is very different than a TENS unit. And then acute and chronic back and neck pain. So I just kind of wanted to list some of the injuries that it treats and problems, but this is kind of where you guys come in. Is the chronic intractable pain. So on the, I guess it would be your left, would be the reflex sympathetic dystrophy or the CRPS. So you have discoloration in the limb. It is definitely a neuropathic pain that's burning, stabbing, sharp, shooting. The color changes, temperature changes in the skin can go from very, very cold to very, very hot. It's very extreme. Neuropathies as well, trigeminal neuralgia, which is a facial pain, fibromyalgia, which is all body, fatigue, tenderness, everything chronic, reflex sympathetic dystrophy, like I said, and then the Ehlers Danlos. Also, I put in that category are severe migraines and like cluster headaches. So we've treated all that, and it's still about the way we do it and what the body's doing, because the body really is meant to heal. And so what we're doing is we're promoting healing is really what we're doing. And so it doesn't really matter if it is EDS or if it's fibromyalgia, because all those are at the very chronic stages of illness, of problems. It can start out as an injury again, and then it goes into something more. And Ehlers Danlos, we know, is genetic, and so you're still, regardless of the name of the condition, you're still dealing with the same things. You're dealing with pain as a symptom. Generally, you're dealing with issues of sleep, gut issues, and things like that. So I'll keep going, because I'm going to be talking about that. So the InterX and the brain. So what we're doing, really, we're doing a lot of things, but one thing that I find that people really need to understand is we're working at the level of the brain. So one thing that we're doing is we're able to communicate or talk to a little small part of the midbrain, and there's a little pea size or almond size thing called the hypothalamus. And the hypothalamus is part of the brain that maintains your function, like blood pressure, your body temperature. It helps to regulate digestion, which is a lot of the problem with people and their electrolytes. But digestion is a big issue, absorption is a big issue, and that's where all that takes place. So there's a communication to that part of the brain that actually is working also on the vagus nerve. And I don't know if you know what the vagus nerve does, but the vagus nerve is huge in the same way, and there's ways you can treat on the vagus nerve, which are going to communicate to the hypothalamus as well. But what the hypothalamus does is it does keep the body in balance. It's your part of what they call, homeostasis, or maintaining the body's status quo. So really, it really is coordinating, and we see it all the time because we see people's stress levels come down right after treatment. They'll feel very relaxed, not as anxious. It does move the body. The hypothalamus and that part of the brain is really moving the body into what they call a parasympathetic. So the sympathetic is where you stay. Like we all wake up in a sympathetic place. So the sympathetic is where your cortisol is pretty high, or it should be higher in the morning, and it should drop down in the afternoon. By the time you're, getting ready for bed, or even before that, you should be pretty relaxed. Oftentimes what happens is you have confusion, a lot of confusion in the body when there's illness, and so the person stays in a sympathetic state. They don't ever drop down to the parasympathetic, and so they don't sleep. So that's one thing that the InterX is going to do. It's going to allow the body to move into that parasympathetic. Okay, so then how do we treat? So you can see that's a picture of me treating a person's face, which you'll see a picture even closer. But our approach is very systemic. If you can see where those pads are, the pads that are placed there look like this. So if you can look down where my picture is, or where I am. So we have these pads. We have these big pads, a 4x4, and then a 3x3. And the 3x3, we wrap it around the leg. So you'll see later what I'm looking at. I look at places, and a lot of that, if you were to even look at your own body, where those pads are on this woman are tender places in the body. But if you look at acupuncture, which we do look at, we're looking at these areas that are tender, but those tender areas are usually acupuncture points as well. So what I have padded up there, I can just, off the top of my head, I've got the lady's stomach channel is padded, her liver's padded, her gallbladder's padded, her bladder's padded. Around her ankle is also the gallbladder channel. And in her arms, I have the small and the large intestine channels padded. So we're putting a ton of energy in the body. And so that is what has to happen, because on the exterior, it seems like, a person will have, the inability to move, or they're in so much pain, or their skin may, even skin breakout. We're looking at skin breakout. Is the body showing up something in the skin? And so what happens with treatment eventually is the skin will begin to clear up. But our approach is very systemic, because we're looking at these areas of inflammation all over the body and all over the skin. And so we're stimulating the body and putting energy into those places that are portals. And those portals, we just know where they are. And those are actually, like I said, they're major acupuncture points where I have them padded on that picture. We combine the device treatment and what it's telling us to do, and it gives us a number readout on the screen here, and it tells me what's happening in that. So if it, let's say the readout's really high, it's telling me that place in the body is really inflamed. So you want to be there. That's where it's going in really, really good. So you don't know. You may have pain actually in your knees, and we can treat around the elbow. We'll get high numbers in the elbow, and reflexively those two places are related. So I can treat the elbows to get knee pain. I can treat the knees to get elbow pain. Pain relief. And then, of course, we discussed the need for lifestyle changes, which a lot of people just need help there. So how do we treat? We treat, and these are the questions that we ask. So we have a line of questioning and a line of thinking. And so it's not always about pain. I have pain listed as the first, because that's usually why people come to see us. They come to see us because they're in pain, they can't walk, they're just not functioning, the pain is over the top by the time they've come, and usually they're on a ton of medications. So, we ask about how long have you had the pain, does the pain move ever, is it constant, is it a localized pain, where is it? And this, again, the device will tell me, even though the person may tell me that they have pain like in their left knee, I know that, if they had a device, they might try to treat their left knee, and it might actually flare them up. So you really want to know how to treat for that, because you wouldn't treat there if it was very chronic. It usually shows up higher in the spine and the neck, and it'll show up actually in the face where we treat as well. We talk about sleep. We'll go back to medications. So I said earlier, and I think, Jennifer, I was talking to you earlier about, the person that was on antibiotics. So antibiotics, that's the question we ask. Have you taken any lately? And what that always drives me to, when I go down a little further, is the nutrition and kind of what you're putting in your system. So we talk about that, and that our foods nowadays are just not very good. It's sad, but our foods are really pretty bad. They're full of GMOs. They're full of antibiotics. And so we are just there to teach. We're there to, when people come to see us, they're not really sure why they're hurting or why their body's not healing. And so I go through the line of questioning is, like, what are you putting in your body? Some young people will say, eat fast food this many times a week. And I'm like, well, that's not really good. But even so, like, some people will tell me, they're having pain, and this might not even just be EDS, they're just having pain. And they don't understand why they're having pain. They've had everything examined. They've had their spine examined. They've had their knees examined. Nothing is wrong through MRI, CT scans. And it's just inflammation. And it goes back to, what are they eating? Are they eating chicken full of, antibiotics? Is it hormone-free? Is it antibiotic-free? What are the eggs that you're eating, and so forth. So we ask those questions. Sleep, how long does it take to fall asleep? Do you stay asleep? And when you wake up, are you rested? I've had people that come in, Janice, I sleep 7 to 8 hours a night. I said, but they will say, I wake up, but I'm so tired. So my whole thought in that is they're sleeping, but their body's not absorbing. So it's still a gut issue. So I'm looking at elimination, which is detoxing the body. I'm looking at digestion, and I'm looking at absorption. Always. I'm asking the question always, why are they so tired? Why do they not have energy? Well, what we're doing, as you saw in the picture before, we're putting a ton of energy in the body. We're not using any needles. We're using just the stainless steel electrodes that are plugged in to these devices that are run on AA batteries. I look at activity, exercise. Are you able to work? If you can't work, why? Is it because, you don't recover well? Oftentimes it is that. It's like you go out and do an activity and you just can't recover. And in that, I think something I did not put in there was the thinking. Oftentimes people say, Janice, I just can't think. I feel foggy brain all the time. When I try to do something, I'm just so forgetful, so it's really hard. I can't recover from any activity because I'm so tired. It still goes back to that middle one, which is the next one, is the gut and the GI. So we do ask the questions of bloating, distension. A lot of people complain of bloating, distension. They'll say they have a lot of gas. They'll have stomach pain, reflux, indigestion. We hear that all day. I discuss elimination. Are they err on the constipated side or diarrhea? Do they take antacids? If so, how long? And then we go into the whole education of what does that do when you've been on those types of medications like antacids over a long period of time. It really is destroying the small intestine is what it's doing. And your small intestine is your organ that helps the body to absorb. And so we just kind of go into internally what's going on so we can help the person process. And sometimes it's medications that may be doing it or long-term use of them, or people that are trying to get off of those things, because oftentimes people will come in on a lot of medication and one of their goals is to try to come off of them and try to go more onto a natural way. And, God still has given us these chemicals in our system, and so oftentimes they're just turned off. The nervous system's turned off, and those chemicals are just failing to produce in the way that they need to or as rapidly as your body needs them to. And over-exercise is something that a lot of people do. Or they'll extend themselves too much, and so they don't ever rest. And that's something we're supposed to be doing, is resting. So I already kind of talked about nutrition. I didn't really talk about sugars, but sugars cause all kinds of problems. It's really bad for your nervous system. And so, we do have people that come in that say, they're not hungry at all. They wake up and they're not hungry, or they're always nauseated, or they have reflux. So Those are things, again, that we look at. We look at, is a person on soft drinks, or do they drink a lot of water, or do they eat late at night? So that's important too, because if you're eating late at night, it just causes your body to not rest well at night, because your brain's working on trying to digest your food, not trying to rest and repair, which is supposed to do rest and repair at night. And again, lastly on this, we look at skin, and skin is huge. I see the skin tells a story to me. And so I look, like I was telling you earlier, the large intestine channels and Chinese meridians are up in the arms. So often our patients will be very red, like in the front of their arms, or they'll have like little bumps on the back of their arms. And that's the small and large intestine. So it tells me internally there's a lot going on. Usually there's antibiotic use with that when it's raised and discolored in the back of the arms, or they're not eating as clean, and it's hard to eat clean. And then just I'll give you examples. And then a lot of times I see in the front of the chest this redness from about here to here, and this is actually the stomach channel. So I look at that, I see that in the face, a lot of rosacea, quote unquote. When no skin product's going to get rid of rosacea. What's going to get rid of rosacea is getting the gut well. So we do look at these charts. So these charts are what I call the western highways, or the cutaneous nerves. So for example, if someone came to see us and they had a cast, I always give this explanation, they cast like on their right leg from the knee all the way to the foot, and let's say it's swollen and painful in the right leg. We could treat on the left leg at the knee and the foot and all in between, and we can get great results of pain reduction and inflammation reduction by treating the opposite side. And that opposite side are, again, these highways. So you have relationships. I can treat the low back and get relief in the knees, just like I can treat the knees and I can get relief in the low back. I can treat the elbows and get relief in the neck, or I can treat the neck and get relief in the elbows and hands. So there's all these highways are hugely important for people to understand, because the cutaneous nerves serve the blood, the bone, and the tissue. So it serves deeper. It's superficial treatment. It doesn't hurt. It feels like a tingling, kind of prickly feeling. It doesn't hurt, but it's serving like the whole nervous system. So that's what the cutaneous nerves do. It's great. Our other charts that we use in the clinic are the eastern highways, which I was discussing before, or organ channels. And so those are, again, everything that I mentioned before, the stomach and the large intestine and the gallbladder and all the very vital organs. Our visceral organs are important for everything. And so once you give those energy, then you're going to help your spine, because everything's coming off the spine. I don't have another chart in here, but everything's coming off the spine. So you have connections with each organ and actually every segment of your spine. So a lot of people will complain of like this mid-thoracic pain, like in between the shoulder blades. They'll complain of that pain. The first thing I ask them is, do you have a gallbladder? And they're like, why are you asking me that? I said, well, that's a reference. That pain refers to the gallbladder. Oftentimes people that have pain in that mid-back do not have a gallbladder. And so I had a young woman with EDS. She also had Lyme. She has POTS. And she also had mast cell. She had all these conditions, and one of her her stabbing pain was in mid-thoracic spine. And now she is doing great. She was able to get out of the house, and now she's actually in graduate school at Texas Women's University. So she's doing really, really well. But she had that thoracic pain, and that thoracic pain, she had a gallbladder removal at a very early age, and I don't know if it should have been removed, but it's removed, and so, but now that pain's gone, and she's able to deal with it. She has a little home unit, so she uses it not on that pain, but what we've taught her to do to try to help that thoracic pain. And then we look at this chart. It's just a referred pain chart, and we're learning all the time. The other therapist and I that works with me, and this was just from the Differential Diagnosis for Physical Therapists. And this is a great book, and that's, if you can see that place up at the top, I think it's number 9, and 9, around the 9 area. That's and this will tell you it's the gallbladder. It's not just the gallbladder, but that's one place it is. So we're looking at this chart all the time, and so this is a great book. If you're having pain, you're not really sure, This is a great book just to kind of help you understand how it is probably related to your more internal problems. Okay, this picture is done because I wanted you to understand that we do look at the whole body. So we do the very first visit a person comes to see us, because usually pain is all over the place. Their pain's not just in one place. Their symptoms aren't just in one area. The symptoms, again, could be fatigue, can be, they're not sleeping well. This is a real general treatment, but the reason why I gave that was to show that we do get numbers, and we get numbers on this device. So we'll put this on every segment of the spine, and on this part of the screen we get numbers. And so the numbers give us the story again. And so you can see in this person, it was the thoracic spine and then the left lumbar area. If I were to guess, this person probably not only had some lower extremity problems, they also had some probably upper extremity issues as well on the right side, because there's this whole relationship with diagonals. So we look at the body very differently, but it does give us real-time problems. So exactly what's going on at the moment. And then I'll talk a little bit about, in general, what the device is doing overall, so it'll help you to understand it a little bit easier, and you'll probably be able to relate to it. But again, in chronic conditions, the treatment's is almost always not performed in the area of pain. So this person might have had some, maybe even some chest pain. They might have had, again, some more lower body pain, but not so much back pain. And then this is me treating the person's face. So again, what this is, the reason why I put this slide in there was to look at the 6 points of the face and how they're related. So this area in here of the body is related to the head and neck. And so I'll show you a chart in there in a minute. This area in here is related to all your internal organs and like your arms all the way to your lumbar spine. And this area in here is related to your lowest part of your back, your sacrum, and your legs and your feet. And so oftentimes when people have leg pain, they also will have headaches. And it's very interesting because I've just over time, you just put things together. So people have lower body pain. I'll say, do you get headaches? And where are your headaches? And generally they're right here. They're right here, and they're kind of right in here. This area here, if I draw from ear to ear, like a line here, and then right in here, in your forehead, is actually related to your legs and your feet. And so oftentimes when people have headaches there, it's caused because it's related. There's all these different relationships. That's kind of what we try to teach people. And so again, but this treatment is very relaxing, and it really does help with sleep. It helps, the parasympathetic is where healing and digestion takes place, absorption takes place, and it's just a place of relaxation. Again, it really is like when people have a home device, I'll tell them, when you're not sleeping, those nights where you wake up, you can't fall back asleep, there's two places that I'd actually put it. I'd tell them to place it on their face and start treating their facial points. And I'd also tell them to treat their lowest part of their back, like their sacral area. Just pat it, lie on the pads, and it'll knock you out. It's kind of interesting. People go, Janice, that works. I'm like, yeah, it does work. It's really interesting how it does, but it works because it puts them back to sleep. And that's huge because sleep is the biggest problem that people have, and that's what keeps them sick. So this next slide is, again, referencing the Chinese medicine or acupuncture points. And these are the main areas. So you saw the woman was padded, her legs were padded. That's where we took this off of, was this chart. And these are places where we can actually take numbers on each one. So if I were to manually treat each point, I would get a number on this device. So I'm looking, where is it going in the body the best? And it really is a place where the energy is being absorbed the best. And often, like I said earlier, let's say it's a right elbow problem, it would be the left knee that we would treat, and we would get great results. If a right elbow was just killing a person, I could work on their left knee, and it would be really active there. That's what we're looking for. So we will look for these numbers get really high. With a home device, it gets really sticky in the area. And that's an area of low impedance. It's an area where the energy is going in really good. It's being absorbed really well in that area. and then the pain goes down, and we teach people how to treat dynamically if it's standing that hurts, or if we're going from sit to stand that hurts, or so we really bring it into using it, in a physical therapy way after we get the pain down. We got to get the pain down. We got to get the energy up. We got to get the sleep better. Once we get the vitality of the person better, then we start working on, okay, let's refine you. What are your problems now? Is it getting out of a chair? Is it getting into a car? What is it? And so then we go into teaching a person how to do that as well. Okay, so the next chart is the organ treatment. And this is a chart. All these charts we give to the patients, like the little ones, like the organ and the acupuncture points and so forth, to teach a person how to use it. And so we show them, the areas in their feet and the areas around their wrists to treat that are going to target these different organs. And it's amazing. If a person has severe back pain, they can treat the organs and their back pain will go down. If they have disc bulges or herniated disc, this is a great treatment for herniated disc. You treat the organs and the disc pain goes down. And so because the disc inflammation is going down, the inflammation in the spine goes down. So it's very interesting. But that's another thing that we do. And so there's a picture of me using, and I'm a two-person treater. So I use two devices because I'm trying to get as much energy and get the person, feeling really good before I leave, before they leave. And so that just has me treating their ankles and feet, and I also have them padded up, which we do in the clinic. And then the scalp treatment, that's really relaxing, and that's with this electrode. And this electrode, I don't know if you can see it, but it's got little prongs on the end. So if a person's bald, obviously they don't have to use this, but most people aren't, but some people are. So if a person came in to see me that was bald, or if they got a device and they wanted to treat themselves, they would just treat with, the flat surface. But you treat hair with this. You can also treat animals. I'll just throw that in because I love animals, and it's great on animals. But the systemic treatment on the scalp is extremely relaxing, and we're looking at the homunculus, which is all the relationships right over the head. And so, again, I was kind of explaining to you all this, and the forehead is your legs and your feet. But that's me treating them, and again, she loved that treatment. Everyone likes that treatment. So this is a case study of the young 18-year-old man that I treated fairly recently. So he was just really willing to be my subject, and he was real excited that I was coming to do this, and so was his mother. But he was diagnosed approximately a year ago. He had it from birth, but his diagnosis, he had no idea what was going on with him, except he was getting extremely clumsy. He had a long history of childhood asthma and allergies. Well, that was a kind of a thing that set him up and sets a lot of people up. That's where the inflammation is. When I ask the question about allergies and asthma, how long have you had it? Is it because your body reacted to something, or were you born with it? And it happens right out of the womb. And so he had it really, really severe. And then all of a sudden he started having problems with just some fatigue. They found out that he had a heart murmur, and then he was diagnosed with POTS. And so then some of you know Dr. Suleiman that are in this area. He had actually gone to see Dr. Suleiman, and Dr. Suleiman is who referred him to us. He also sees an orthopedic doctor by the name of Dr. Humanek, and Dr. Humanek now knows about us. So that was really cool to meet him recently. But he had a lot of problems walking. He was running into doors, very, very, very clumsy. He was already clumsy. Like his mom said, he was already clumsy to begin with, but this was just over the top. He kept falling, so he was injuring himself, so they put him in a wheelchair after he hit his head from a fall. And he was complaining of being very, very weak and dizzy, like so many do with POTS. And so this is really interesting. And earlier, I think I was talking to you about the lady with Lyme's and with the POTS and with the EDS, who no longer has POTS now, and neither does this young man. He got to the point where being able to do exercises, and he's able to get back to life, and what we're doing is we're increasing your microcirculation as well. And so, over time, his POTS, he has no sign of POTS. I just saw him today, and he looks great. He came in with a pain of like a 0.5, which I don't even know if I live with a pain of a 0.5 every day, but he's doing great. His knees don't hurt anymore. He did come in at a very high level of pain in the knees. He also had elbow pain, which I told him later how that related to the knees. A lot of hand pain later on came on. He had numbness in his fingers. Wasn't able. They told him he had like this micrographia, which means you can't write small, and it really wasn't micrographia that he had. It was the fact that he had numbness in his fingers, and so he couldn't type well. He's back to doing his cell phone and all the things that kids do. His energy level is pretty amazing because he just got back from Israel and Poland on a school trip. He had headaches, and those he didn't complain. He didn't complain of that. Real bad sleep. That was the thing that I was just terrible. You're 18 years old, you're in high school, you're going to 2 schools because you're like this super smart kid, and he just could not sleep. He couldn't fall asleep. Took him hours to fall asleep, and he just kept waking up all night. So then all of a sudden you got all this inflammation that's building up, and then you start having more and more problems. You think you're dying, literally. You don't know what to do. And so I was just really grateful that Dr. Siddleman sent him to us. He had a lot of irregular bowels, a lot of this IBS, went from diarrhea to constipation. We talked about that, and all that straightened out. He did have the extreme nausea, and he was using the bathroom a lot, which his mom had no clue of that until he told me that when I asked him the question because of just what I've seen. Couldn't walk any distance at all, very, very unstable, and he just felt very hopeless. And he told me later on, he's like, I'm the main skeptic. He goes, I'm a skeptical person. And he goes, I was so skeptical. He goes, but I had nothing to lose. And he said, so he just it was really neat because he's a real quiet boy. And as he got well, after the first series of treatments, all of a sudden he just out of the blue just hugs me when he leaves, which I was really touched by that. But he's a really good kid. So he's a really, really great kid, smart. And he's going to go a long way in life. But people ask us, what do they, believe that InterX is doing? Well, InterX is doing a lot of things. Again, like I said, so much of it that I don't even know everything it's doing. I'll just be honest with you. I really don't. I do know when I went to England that it's definitely a regulatory treatment. It is normalizing function. I see people's internal organs getting better. I can tell you stories and stories and stories that I don't have time to tell you about, with just regulating kidney dysfunction and things like that. Herring's Law, I'm going to show you, which is the next slide, about it. It's really what it's doing. And that's something that I learned in the UK when I went there to train. But I see it all the time now. So you actually see this law, it's law of healing. It's also called the law of cure. It's a homeopathic doctor named Dr. Herring, but I'll tell you a little bit more about that in a minute. The functional mobility, so that improves before longer lasting pain relief. So like the young boy that I was just speaking of, the 18-year-old, he had such chronic knee pain that he just couldn't move. He'd just come out of a wheelchair, and it was so hard for him to walk. No distance at all could he walk. And then all of a sudden, he comes in and he's like, I went for a walk. And, I was able to walk around the house. And I said, well, he says, but I'm still hurting, but I can do it. And his mom was watching him. He's going to school. He's able to participate when he was having to do some homebound things before because he was so bad. He's like, I feel like going to school. So his energy was picking up as I was watching him. And then the mobility just starts to improve, but the person may still have pain. And eventually the pain starts coming down because the pain ends up being that neuropathic pain of burning, stabbing, sharp, shooting pain starts to come down, and that burning and stabbing goes down, and it's more of this aching, just tired, fatigue feeling instead of this crazy neuropathic pain, which I just can't imagine. The burning and the sharp and the stabbing, constantly. So the constant pain becomes less over time. You have improved stability in the joints like it was with this young boy. With improved coordination, again, because you're increasing the connection to those proprioceptors in the joints. And then you'll see improved GI function, like we talked about earlier, and just the skin will start clearing up. He started breaking out. He was really going through this detox event during treatment where his skin broke out, and he'd come in, and that's one of our questions when people come in is, is your skin changing at all? And they're like, yeah, I'm breaking out. They're not really happy with us. But I try to explain to them why. Your skin's breaking out because your body's detoxing and it's flushing toxins. I mean, we don't even know all the toxins that are in there. If you don't go to a naturopathic doctor to get tested, it could be metals from drugs. It could be metals that you breathed in from outside. It could be something you drank or some water that was bad, that you went on a vacation or you lived somewhere all your life and you were drinking bad water. You don't know. But that starts to detox. I get people who are big-time smokers, and I'll smell it. Like they have not smoked in 3 years, but it's still coming out of their body. And this is like 3 years post-smoking. I'll have them in the clinic, and I smell smoke. And I'll ask them, do you smoke? Well, I used to. So I smell it. It's still in their system, and it starts to actually come out of their skin. They start to break out. We've had some emotional breakouts because it's still, again, I'm going to talk about this Hering's Law here in a minute, but it is about pain. It's not always just physical pain. Pain is so emotional, and it can be spiritual and psychological as well. And so it also increases the physical pain when you have that deep-seated other issues of the mind and the heart. And so that's why I put in this scripture. It's one of my favorite scriptures. As far as he thinks in his heart, so is he. And I think it's so important because when you're riddled with pain, I've seen people that they're scared. It's like a fear that they have because the pain really does take your energy. It zaps your energy, and it just makes you where you don't feel like you can do anything. And so there's a fear of pain, of having to get up and move. And what are you going to do if you're in the grocery store and you have a pain attack? And I hear that all the time. And so that's what I see over time, like the recovery that a person has and their functional ability is so much greater instead of like being wiped out after going and spending a day out to lunch with a friend, like you're wiped out the next day. Instead of being wiped out a whole day, you might only be wiped out for 6 hours. And then it becomes less and less and less and less over time. Because again, we're putting a ton of energy in the body. Okay, this is Dr. Hering. Constantine Hering, the father of American homeopathy. And I learned this in the UK, didn't understand it until I actually went through it myself. But it really is. The direction of healing is from the inside out. And so you kind of see that, and the Lord really showed me that in trees. One year he just kept showing me trees. And so he showed me that the tree was dead on one side. And actually the tree was really dead because the root of the tree was dead, and the outside appeared semi-alive, kind of like us. We seemingly appear like we're functioning, and we may look like we're okay, but on the inside, like there's a lot of sickness. And so the healing takes place from the inside out. You're going to see that. You're going to see, people don't tell me, Janice, I have pain relief. They'll say, my mood's different. Janice, I feel less anxious. My mood's different. I feel energized. People come off the table and they'll say, I feel this euphoria. And I always hear that. I was like, okay, I got to understand what that means. Euphoria is like this energy and this kind of, like I feel like I can live or I can do something. Because, again, the pain really does zap you. So, again, it's an inside-out healing, and it's a top-to-bottom healing. So let's say a person comes to me and they'll have all-body pain, but most recently they were putting their shirt on, and they get this catch in their shoulder and neck, and it's like this new pain that they have. Well, they'll come in to see me. Let's say I start treating them, but their pain is like a fibromyalgia, like all body pain. They have lower body pain plus upper body pain. So what will happen is they'll start feeling their mood will get a little bit lighter, and then eventually what's going to happen is this neck and shoulder pain will totally go away, and it won't come back. It's going to work on the next thing that was their problem. And so it reverses all the way back to the very original problem. And some people can tell me the very first time they knew what was happening to them is when, they might have been in college and they were just, at grinding, studying and weren't getting any sleep. And then they had a stress event of a death in the family. And that's all of a sudden. And then they lifted something and they hurt their back. And from that time on, their back was just terrible. And then it started getting worse and spreading out. It'll unwind all the way back to that original back injury or whatever the original injury is. So understand that it does go in this order, and I'm always talking about that to remind people. And it actually helps me to manage symptoms, and it helps the person to not get scared if something comes back. The lady that I was telling you about earlier, Jennifer, who had the foot pain, and she had the real lax ligaments everywhere, her jaw, her feet, and her newest problem was this chronic foot, ankle, and leg pain in the tibial area around her shins and so forth. And that's gone. That's almost fully gone. And now she's starting to have some pain that she had when she was in a car accident on the left side of her body. And she's starting to have some of her fibro symptoms that seemingly are trying to return, but she's so happy that she can walk and stand now. And she understands that she doesn't need to be fearful that these fibro kind of symptoms seem like they're returning, but what's happening is her body's trying to heal. Okay, and so that's the other picture of the little guy of the inward to outward healing, top to bottom, and then in order of reverse order of the symptoms are the most important organs, and the first organ that has to heal is your large intestine, and then it goes into the small intestine and your stomach and so forth. So why is InterX effective? It's so effective because we can get very specific with the scanning of the device over the skin. And so the scanning can be with numbers, like I showed you the picture with numbers, or it can actually be scanning right over the skin, and the device actually sticks to the skin. That's how you would use it at home, is to be able to see where is it sticking around that area of pain or a related area of pain or a related area. But it's releasing the cytokines, which are anti-inflammatory and pro-inflammatory. So you're releasing both things. You need some pro-inflammatories to heal, to protect. They help to protect, but if you produce too many is when you have a problem. So you're still looking for those areas. You're putting the energy in the places where the device grabs, like the paper says up here, and you're getting an autonomic response and trying to move into a parasympathetic response in general. So that you have a high amplitude, high density current. And so what happens is with the high density, high amplitude current coming out of the head of the device or through one of these electrodes, you're able to target the stimulation exactly where the energy is going in the body best. And you're able to find it by the way the device responds on the skin. So you're getting, you're allowing the stimulation to be very, very targeted to change the autonomic nervous system. You're getting a cumulative, longer lasting relief, like I was saying. The treatment is going to cause these chemicals to start just building up on their own, and naturally as our body does that. So you get this opioid release, which are natural morphine. You get this kind of cascade effect to all these cytokines start building up, and they start releasing on their own. Even when you stop treating, your body continues to get well, which is interesting as well. So you're getting tons of central nervous system response. The waveform on this is constantly changing, so your body doesn't accommodate to the signal. So you don't get just one or two selections. You have a number of selections on here, and you're moving it all around the body, not just using it on the same area. So you're not going to get accommodation. And so it really is, you're going to have some pretty immediate results, and again, over time, they're going to be longer and longer lasting. People ask me all the time, how long does this take? And this is what I was talking about when I said these sessions. The sessions are, if you have an acute pain or inflammation, even if you have a chronic condition, let's say you sprain your ankle or you stub your toe, you could treat it very quickly. Like, let's say you're on a walk and you roll your ankle and it's like, oh my gosh, it's not going to heal very quickly. Treat immediately right on the ankle, right around the injury. You're going to scan it over the body. You're going to find where it's going in the body really good, and you're going to treat that often. So let's say you get about an hour to 2 hours of relief and your ankle feels good, and then you sit down for a while and you get up and it's hurting again. You're going to treat again. So you treat often. That's how athletes treat. A lot of athletes use this device. And so same thing with any part of the body, you're going to treat really, really quickly. It can also help. Oftentimes people will go and they'll have some work on their teeth, mouth work. And so again, you're going to have some inflammation from that. So you can treat for that as well. Any kind of inflammation from a bug bite even, it can help that as well. Chronic pain's a little bit tougher, but it's still doable, and that's what we see in the clinic. And so our initial assessment and the subsequent visits up to 10 to 14 treatments. Some can get out of there in 6 treatments. A lot of patients, they're like, Janice, I can only come this often or whatever. I'm like, well, I'm going to tell you, I'm not going to promise you the world, but what I'm going to say is if you're only going to come in the treatment in the clinic for just so many sessions, you can only make it, or you can't even come in the clinic. What I would recommend is doing home treatment, and we'll teach you how to do home treatment. And that's the pilot study that I did on Ehlers Danlos years and years ago, were 4 people who actually were at home and they were pretty homebound. And so they used the home device and were able to get a lot of changes with just general pain. But again, back to the clinic. So we treat, and then during the break, the reason why I put that in there is during the break you actually get better. People are actually feeling better on the break. They have more energy, they're sleeping better, their pain might be down, by half a point. It's not as intense. Then they come in for another set of sessions, and those sessions is interesting. With the break and with the sessions, the breaks go longer, the sessions are shorter, as you can see, because the body is truly healing. So the third set of treatments, maybe 4 to 6 sessions, and then after that they go on a break, and sometimes they don't come back. A lot of times what I recommend for people who are chronic is either rent or purchase a device and maybe get on a maintenance program through the clinic. And the maintenance program may be, you come in, it's really interesting how you can be treated for a number of sessions and your body recognizes the treatment very quickly, and all those chemicals start building up quickly again. So people ask, how long do you have to do this? Do you do this forever? Well, it's depending on what are you doing with the other parts of your life. Have you changed your diet? Are you changing your sleep patterns? Is your sleep getting better, which it should be? So maintenance, again, in the clinic, if you can't get your symptoms under control, you would definitely come into the clinic. And so the results that we see, that I wanted you to take, what I did was that you do have a happier gut, that there's improved sleep, improved energy, an improved sense of well-being, which all of us need all of that. And then just the hope for healing, and just something that I would want to say to each of you is just that God's not finished with any of you. Obviously, you're still here, and there's hope. There's really hope. That's what I want to be able to give. That's something that our clinic wants to do, is to be able to give people hope that they can be real, they can be well, and they can live a very productive life. And so don't give up, And then I just wanted to show you a picture of my friend. He's the 18-year-old that actually couldn't smile, didn't talk to me much, but he really did really, really well. So he's a happier camper. And then this is just the devices, and you can see in the corners the dome, which is the large attachment that goes with the home unit, and then the little dual flex, which I have here, that actually you can strap that on your leg, and you can actually walk with that. Same with this other piece. It's a larger piece that just goes on the back, and then you have the comb. And then I just threw in the professional device, which gives you numbers. And then lastly, I just want to thank you. And so I pray that your hearts will be flooded with light, that you can understand the confident hope that He's given to those who He's and that, there's just so much that I wish for all of you. And so I really appreciate the time and having me speak to you. And I hope that this has just enlightened you, and that you'll think, about really trying to get well and helping your body. And anything we can do to help you, call our clinic. You can email me. I can give all the information to Jennifer, and I'd be happy to speak to any of you. Thank you very much.
Thank you. Thank you so much. Do you have time for a couple of questions?
Sure, I do.
Okay, super. Thank you so much. This was so, I want to come see you right away. This is so, so interesting. One of the things that interested me the most is the way that the device and the treatment targets inflammation, because so many of us have mast cell activation disorders, which is basically inflammation. And,
Yes.
Some specialists will say that that the mast cell disorder actually is the root of all of the symptoms in POTS and in EDS. And so this is just kind of just like a comment, but one of the things that, you know, I wanted to say is when I started treating my mast cell activation disorder, my POTS symptoms went away. And so when I'm having inflammation in my body and the mast cell symptoms are coming back, that's when the POTS symptoms flare up again. And so, my question just about, you know, inflammation in the gut is, you know, I'm seeing a gastroenterologist right now who's really, he's kind of a SIBO expert. And so, you know, we discovered that I do have a lot of inflammation in my gut, and I and some other people in my group, we have very low serotonin levels. So, you know, for example, my blood serotonin level was tested as it was tested and it came back as a 4, where normal is 50 to 200. And this other woman I was talking to said her serotonin level was a 6. And her doctor was just amazed because she said the lowest that she had ever seen before was a level of 20. And that person was institutionalized in a mental hospital.
Wow.
Yeah. So, I mean, I guess I don't really know how to phrase my question exactly, but one of the things that is most attractive to me is the way that it's able to treat the inflammation in the gut and in the small intestine. And can you just remind me a little bit about the technology and how that actually works?
Well, again, we're working to, you know, again, being right over the skin. So we work, and I don't think that on here that I actually had a picture of treating right over the abdomen, but you know that 85% or more of serotonin is made in the gut. You were aware of that, right? And so it's because of that people will have, you know, mood changes or depression or the anxiety and so forth. And that's what keeps a lot of people from being able to just go out and do things and work and things like that and sleep and just thrive. And so what we're doing, again, because we're able to work right over the skin, we're able to work and put this high density or greater density and high amplitude of treatment, of stimulation in the body without hurting anything, right? And so you're able to communicate to levels of the brain. And so the levels of the brain, right, are going to affect the gut, and then it goes back and forth. So you're still working on, again, this hypothalamus, you're working on the vagus nerve, which is also stimulation of the gut. And so you're stimulating the normalization of these chemicals, you know, in the gut, which is the main one's going to be serotonin. And then that's going to affect your melatonin. It's going to affect your adrenals. There's usually when you have serotonin, you know, minimal serotonin, you have adrenal fatigue, or, you know, they're gone, not gone, but they're so fatigued, your adrenals. And so there's ways to stimulate the adrenal. So we're trying to hit the system at every aspect, whether it's over the brain, working with, like right over the head, working right over the gut, or working through the organs, or working on the vagus nerve. So the vagus nerve stimulation would be right back here, right by the ear. And so everyone says, you know, they just feel extremely relaxed, and again, their mood comes up. You know, I'd like to actually do a study that shows an increase of serotonin uptake. And that's something that would just have to be done through blood. And so we're working with some doctors that hopefully we can get that done, you know, fairly quickly to show that. But that would be something that would be huge for, you know, your group, for anyone with mast cell, because we work with people, and I didn't mention that with this young kid had mast cell, as well as the young lady with Lyme, she had mast cell as well. And, you know, she's careful about what she eats. She's gluten-free. She's all those, you know, everything free. But she's able to expand some of the things that she's eating now. And so part of that's, there's a lot of things going on. There's another chemical that's not being, you know, made that controls the histamine or helps control the histamine. And so there's some supplementation that you can do to try to help that. But over time, you're hoping that your body will be restored in that way too, so that you're not making so much histamine. So that's another problem too. So
awesome.
we see
need a lab for that.
Yeah, because mast cell's huge with what we see, and that's why Dr. Suleiman has referred people to us. He doesn't refer just for mast cell; it just becomes part of another symptom of the Ehlers Danlos. But you got to get the connective tissue solid. You got to get it to not, if your gut is just kind of hanging there because of connective tissue is not strong, you can't do anything about it. But this helps. And so that's what you're trying to do. If you notice that, people start noticing the fact that their gut is just functioning better. Again, you have the increase of the mood. That's the thing that people tell me all the time. It's like, my anxiety's down. I don't feel low. I feel that's just the most, and the fact that they have energy. Like you actually have energy because you can get energy. You can get the energy from your food. That's what we're supposed to be doing.
Right.
And so I don't know if that answers that. I don't know specific tests that have been done for that, but I know that we increase the serotonin uptake most definitely, just because of clinically what we're seeing.
That's very cool. And then how long, you're talking about the relaxation effects of a session. How long after the session does that last? Or does it kind of matter what you do after you leave the session?
It's both. So, both things. I mean, if you're going to cause yourself inflammation, it's going to reduce that, and so then the body's trying to heal that, whatever it is. But the results will last anywhere, and I've had people that they'll say they got up, I'm just being honest, they'll get up and they'll say, I had pain relief is what they're looking at. They're just looking at pain. I had pain relief from when I left you till I got to my car. And I said, okay, well, how was your sleep that night? Well, it was a little bit better. So I'm looking at other things, if that makes sense.
Sure.
But you're looking for more than just pain relief. And so I ask those questions because I'm trying to get a good handle of how sick their gut is, right?
Right.
If a person comes to me and they're on a really pretty clean diet, and when I'm saying clean, I mean, you know what I mean. You're talking about whole foods, right? Mm-hmm. Not a lot of sugar, not a lot of processed foods. If they come to me in that form, they're going to actually have better results than quicker results when it comes to pain relief and things like that. But when you say how long can it last, it can last up to 72 hours in the first set of sessions. But what's going to happen over time, Jennifer, is it builds on top of each other. And that's what I'm saying. Eventually, that serotonin uptake is going to stay up there. It's not going to keep dropping back down. You're going to be able to do things. Especially if you get a home unit, you'll notice a big difference. If you start feeling a little bit blue or low or whatever it is that the serotonin does to just yourself, if it drops, you'll be able to treat, and you're going to notice instantly. Usually it's energy. Usually it's amount of energy. Like you're not so chronically fatigued, like you just feel like you can't even pick up your head and go anywhere. That's the change that I see, is the energy. And so then that energy comes it's so many more things. It is hope. You have hope that this isn't going to stay down forever, but it goes back to the mast cell and the EDS. So you've got to you can change the POTS with a lot of that too. Not to say that, because serotonin is produced when you exercise, right? So as you exercise, that's going to also change the POTS. So there's a lot of things that can change POTS. Mm-hmm. Obviously the serotonin, and then get the mast cell under control. But this is one way. This is just a tool that can help you on top of the things that you already know. So
awesome. Callista or Mary, I don't know if your microphone is on, Mary, but do either of you have any questions?
I'm curious. I'm ready to move into your clinic. It's
okay.
Awesome. A lot of us aren't able to work and have a lot of medical bills, and so financially, what is insurance accepted, or what's the typical cost of purchasing a unit versus renting?
Okay, so through clinic treatments, our clinic treatments we're in network. We're actually out of network for all insurances. We do take Medicare, and we're out of network. So we accept all insurances, but we're on an out of network plan. So whatever your out of network plan would be is what we accept. So it could be Blue Cross Blue Shield, it could be Aetna, it could be any of those. We do accept them. And as far as if a person doesn't have any insurance at all and they have to go that route, it's $150 a session. And the rental of the device, let me just show you, is this piece or purchase, this piece, and then one of the two of these. It's either this big one if you want a big one. A lot of people grab this one. They like this double pad here just because they can, they like it because they can put it across a knee or an elbow or so forth. I actually like the big one because it can really cover the spine, and I like to treat the spine. I like that one a lot. But you get these 3 pieces, and then there's another electrode on this side. So on this, there's a little head here. So the rental of a device, the rent to own, if a person came off the street and they were just, like they didn't come to the clinic, the device would be $1,550, so $1,550 for that whole kit. And it's $150 a month to rent. It's $150 a month to rent, and then we teach you how to use it. I would recommend anyone, let's say you were strapped for, I understand being strapped for finances and so forth because you can't work, would be to try to come in for at least a handful of sessions in the clinic so you really understand how to use it. I would start teaching you fairly immediately. People that just flat can't get out of the house, I'd be willing to do a Skype or work with my brother and do a training online like we are right now just to help you, and we could do like a number of people to train. So I'd work that out and just do that for you. So, just because I really want to help, I know that you can be better, and I know that there's a way. Like, I would love for you to talk to this woman that has Lyme and POTS and all that, and she's working now. She was totally homebound. She's working from home. Her mom helped her get a business, and she's now in graduate school, and she's working a 30-hour job now and in school. And I just talked to her the other day, and she said, Janice, I have very little pain. I have all kinds of energy. She walks her dog. She's got a happy gut. Her Lyme is no problem. She's not, now not having to be on any kind of medication as far as that goes. I think she takes some kind of over-the-counter occasionally to help her sleep. I don't know if it's I don't know what it's called. She's told me before, but it's like an OTC to sleep. But she's doing super well. But I don't know if that answers your question. It's easier, it would be good if you could come in for some treatments, but if you can't, I understand. I would still try to help you with running a device. The purchase of the device, if you come in for treatment, will reduce. The whole purchase would reduce by about $250. So you'd get it for less just because you're coming in for some treatment. So even if you came in for a few treatments, the price of the device will lessen for you. So we actually sell the device in the clinic for $1,200. So if you were to purchase it. But you can also do a rent, and there is like a charge, some type of charge for, having to finance it. So there's a slight charge for that. So it's just best if you can somehow purchase it. We do take Care Credit. So if you're familiar with Care Credit works for our clinic as well. So did that answer your question?
Yes, it did. Thank you.
Okay, you're welcome. You're welcome.
So is the rental, is it a rent to own type program, or is it more like just when you're finished with it, you send it back? What happens is, let's say you rent it and the first month's $150, and so what happens is if you rent a second month, you get credit for half of that. So you get $75 towards the purchase. So then you get $75 towards the purchase, and you'd purchase it at that point if it's working for you. If not, you decide to rent it again, then the next month you'd get $150 down towards the purchase. So every month you're not losing the whole amount, but you do lose 50% for every time you're having to rent. But I know it will help you if you treat. And if you do the work, it's going to help you. And if you do the things, again, like the supplementation, we talk about supplementation. As some of you might have already seen, like a naturopathic doctor or a clinical nutritionist, really listen to what they're saying. But the problem with some of the times is just the absorption. I keep finding that the problem is absorption. It's not necessarily elimination all the time and digestion. It's absorption, and I think that's the silent killer. I think that even if you go and get great supplementation, you can have the best supplementation, pharmaceutical grade supplements, and you're not absorbing it.
And so
Right.
and you just can't get well. So that's, I know we're helping the body to absorb naturally. So
That's great. Absorption is a major problem in our
it
population.
is a major problem.
Yeah, really. I mean, and not just in EDS, but in general, because of, like you
In
said.
general. Yep, it is.
Okay,
So
any other
questions?
No?
No, guess not.
No? Okay, well, this sounds great. It was really informative and just very exciting. It's a very exciting potential therapy. It sounds like it could really help. And I know I couldn't believe what it did for my husband. I mean, most people who have Bell's palsy, it goes away in 6 to 8 weeks, right? No, but he had it for 2 years. And so we're like, okay, well, it's permanent. It's permanent at this point. But then to be able to get movement back through this therapy was so amazing. So anyway, just feel blessed to have connected with you. And
feel blessed too. Thank you so much.
Spread this information far and wide.
Okay.
And we're going to get a lot of viewers who are not here live with us today who have expressed interest. So get that posted, and just thank you very much.
Yeah, and I'll connect with you, Jennifer. I think you have all my contact information, so feel free to pass that on to whoever. I didn't bring anything here, but with my phone number and then my email.
Sure, I will post that contact information when we get the video up. And then a big thank you to your brother and his company for sponsoring for sponsoring it's I2I Technologies?
Yes, I Technologies.
Okay, great. Yeah, big thank you to them. This is very
cool. I will. Yeah, he's a great guy. Okay. You guys have a great day. Thank you so much. Okay. God bless.
God bless. Bye.